Good day, everyone. Welcome to our presentation on the digital transformation of medication refill management through the My Ubat application. This presentation is prepared for the subject BTM532, Management of Digital Transformation. Me and Gibson will analyze how My Ubat supports digital transformation in healthcare services by applying concepts such as strategic digital transformation, VUCA, the 4Vs of data, and the HINGE framework. Let us begin by understanding the work process selected for this.
Greeting and good day to our lecturer and everyone here. Now I would like to introduce the background of My Ubat. My Ubat is a mobile application developed by Pharmacy Service Program under Ministry of Health Malaysia. This application was designed to help patients manage their repeat medication supply more conveniently through digital technology. The main function of My Ubat include medication refill request, collection appointment arrangement, medication collecting tracking, and patient notification. The target user are patients who require long-term medication, especially those who with chronic illness such as diabetes and hypertension. Through this application, patients can reduce unnecessary visits to healthcare facility and enjoy a more efficient medication collection process.
For this case study, me and Gibson selected medication refill management process within the My Ubat application. The process begins when a patient logs into the application and submits a medication refill request. The request is then reviewed by the pharmacy department before the medication is prepared. Once the medication is ready, the patient receives a notification and can proceed with the collection at the designed healthcare facility. This digital process helps reduce waiting time, improve operational efficiency, and provide greater convenience for patients. It also supports healthcare providers by reducing manual administrative tasks and improving workflow management.
Next, let us discuss why digital transformation is important in healthcare service. Before the implementation of My Ubat, patients were required to visit hospital and clinic physically. This often results in long time waiting, crowded pharmacy counter, and manual administrative process. As patient expectations continue to evolve, healthcare organizations must provide services that are faster, more accessible, and more convenient. My Ubat addresses these challenges by allowing patients to submit refill requests online, receive notification digitally, and schedule medication collection more efficiently. As a result, the application improves service accessibility while reducing congestion and waiting time at healthcare facility.
Next, we will discuss strategic digital transformation. Strategic digital transformation refers to the use of digital technologies to improve organizational performance, services delivery, and long-term competitiveness. In the case of My Ubat here, there are three main objectives. The first objective is operational excellence, which focus on improving efficiency and reducing administrative workload. The second objective is enhancing patient experience by providing faster and more convenient services. The third objective is supporting data-driven healthcare through better information management and decision-making. These objectives help ensure that healthcare services remain efficient, accessible, and responsive to patient needs.
Now let's look at My Ubat from a VUCA perspective. VUCA stands for volatility, uncertainty, complexity, and ambiguity. Healthcare organizations face changing patient demand, rapid technological development, and complex service management. My Ubat helps address these challenges through digital refill requests, appointment management, and centralized information access. This allows healthcare service to be delivered more efficiently and effectively.
Another important concept in digital transformation is the 4V's of data. First is volume, which refers to the large amount of healthcare information managed by the system, including patient records and medication requests. Second is velocity, which refers to how quickly information is processed and delivered through application and email notifications. Third is variety, which includes different types of data such as prescription record, medication information, and patient details. Well, finally, veracity refers to data accuracy and reliability. An example of the pharmaceutical filters, which help users verify the authenticity of medicines. Together, these elements demonstrate the importance of data in supporting effective digital healthcare services.
To evaluate the digital transformation of Myubat, our group applies the HINGE framework. HINGE stands for Horizon Scanning, Internal Audit, New Model Generation, Gap Analysis, and Evaluation of Options. This framework provides a structured approach for organizations to identify opportunities, assess current capabilities, generate innovative ideas, identify performance gaps, and evaluate possible solutions. Using this framework allows us to better understand Myubat's current performance and future development opportunities.
The first stage of the HINGE framework is horizon scanning. This stage focuses on identifying future trends and technologies that may influence healthcare services. Based on our research, several trends are becoming increasingly important in the healthcare sector. One example is artificial intelligence, which can be used to provide personalized medication reminders and improve patient support. Another trend is online healthcare consultation, where patients can communicate with healthcare professionals remotely. This can improve accessibility, especially for patients who face difficulty visiting healthcare facilities. In addition, such as My Sejahtera and cloud-based healthcare systems are becoming more common because they allow healthcare information to be shared more efficiently across different services. This trend provides valuable opportunities for Myubat to expand its capabilities and become a more comprehensive digital healthcare platform in the future.
Next is the internal audit stage. Based on our analysis, Myubat already offers several useful digital healthcare services. For our user perspective, one of the biggest advantages is convenience. Patients can manage medication-related matters through a mobile application instead of relying entirely on physical visit to healthcare facility. Another strength is notification system. Users receive updates through email and application, helping them stay informed about medication collection schedule. Features such as pharmaceutical and digital prescription record also add value by improving medicine safety and information accessibility. However, there is still room for improvement. For example, Myubat does not currently provide direct online consultation with pharmacies, and its integration with other healthcare platforms remain limited. This area can be explored for future development.
The next stage is new model generation. Based on the opportunities identified during horizon scanning, our group proposed several improvements that could enhance the functionality and value of Myubat in the future. First is an AI healthcare chatbot. It can provide basic healthcare information, medication guidance, and frequently asked questions 24 hours a day. This feature would reduce the burden on healthcare staff. Second is smart medication reminder system. It uses personalized schedules and notifications to help patients to take their medication on time. This could significantly improve medication adherence, particularly among elderly patients and individuals with chronic disease. The third improvement is an online pharmacist consultation feature. It allows patients to communicate directly with pharmacists through chat or video consultation. This can provide greater convenience and ensure patients receive professional advice without needing to visit a healthcare facility physically. In addition, we propose integration with MySejahtera and other healthcare databases to create a more connected healthcare ecosystem. This integration would allow users to access their medication history, health records, and prescription through a single platform, improving data accessibility and continuity of care. Another innovation is medication delivery tracking features. These can enable patients to monitor the status of their medication orders in real time. Furthermore, Myubat could introduce predictive health analytics by using artificial intelligence (AI) to analyze medication usage patterns and identify potential health risks. The system can help provide early warning, personalized recommendation, and preventive healthcare suggestions to users. The rationale behind this improvement is to transform Myubat application from a simple medication management application into a comprehensive digital healthcare platform. This innovation has the potential to increase patient engagement, improve medication adherence, enhance healthcare accessibility, and ultimately contribute to better health outcomes and higher service quality.
Next is the gap analysis stage. Although Myubat already provides several useful features, our group identified some gaps between current system and its future potential. For example, while the application currently sends notification and reminder, these are still general updates. In future, artificial intelligence could be used to provide personalized reminder based on patient medication schedule. Another gap is communication. Currently, patients can receive information through the application, but they cannot directly consult a pharmacist online. Adding this feature could be improve accessibility and patient engagement. Lastly, greater integration with healthcare platforms such as MySejahtera could create a more connected healthcare ecosystem. By addressing these gaps, Myubat can evolve from a medication management application into more comprehensive digital healthcare platform.
The final stage of the HINGE framework is evaluation of strategic options. In this stage, the proposed solutions are measured based on their cost and potential impact. Among the proposed technologies, smart medication reminders are considered the most practical option because they are relatively easy to implement and provide immediate benefit to patients. AI chatbots are also a valuable option because they can improve communication and provide support at any time. Although MySejahtera integration may require higher implementation costs, it offers significant long-term benefits by creating a more connected healthcare ecosystem. And last, online consultation is a valuable option because it enhances communication between patient and healthcare professionals while improving access to healthcare services. Although it requires moderate implementation costs, it provides high strategic impact through greater convenience, accessibility, and patient engagement. Therefore, these technologies should be considered priorities for future development.
Digital transformation through Myubat create value for different stakeholders. For patients, the application provides greater convenience by reducing waiting time and allowing healthcare service to be accessed more easily. Features such as pharma checker and digital prescription record also help patients manage their healthcare information more effectively. For healthcare providers, Myubat reduces administrative workload and improve service efficiency. Instead of handling many manual processes, staff also can focus on delivering better patient care. At the same time, the government benefits from improved data management and more effective healthcare planning. Overall, Myubat demonstrates how digital technology can create value for patients, healthcare providers, and healthcare system as a whole.
In conclusion, Myubat demonstrates how digital transformation can improve healthcare service delivery through mobile technology. By applying HINGE framework, me and Gibson was able to evaluate the current system, identify future opportunities, and propose several recommendations for improvement. Overall, Myubat has successfully improved efficiency, accessibility, and patient convenience while supporting Malaysia healthcare digitalization effort. We recommend future enhancements such as AI healthcare chatbot, smart medication reminders, online pharmacy consultation, and integration with MySejahtera. This improvement can further strengthen the digital healthcare ecosystem and improve patient experience. Thank you for your attention. We hope this presentation has provided valuable insight into the digital transformation of healthcare services through Myubat.